We welcome you to Trio Maryland's February Zoom meeting. I'm Marty Marin, and this is my wife, Michelle, and together we manage Trio Maryland. We'd like to welcome all our members and guests this morning and thank you for attending. Today's topic is very special, what you should know about memory loss. Our next meeting is on Saturday, March the 8th, and of course, March is National Kidney Month. So look for the meeting announcement over the next couple of weeks with all the details.
Good morning. Good to see y'all. We're very fortunate today to have our guest speaker, Claire Liu. Claire S. Liu is currently a community outreach specialist at the Johns Hopkins Alzheimer's Disease Research Center. She has a degree in Science and Technology Studies from NYU Tandon School of Engineering and a master's in Public Health from the University of Michigan. Claire has gained experiences in behavior change, health education, and community engagement through research, grassroots advocacy, and various leadership positions. She's very passionate about fostering meaningful connections and creating tangible, lasting impact in the community she serves. Thank you so much for presenting to our group.
Thank you so much, Michelle and Marty, for that beautiful introduction. And thank you to everyone here who tuned in on this lovely Saturday. My name is Claire. I'm from the Johns Hopkins Alzheimer's Disease Research Center. And I guess let's get into it. This is fairly casual, so if at any point someone wants to pop a question in the chat, we'll finish up by doing question answer. And then I'll also have a handout to post that will summarize the key points that I'll be talking about. So feel free to take notes, but you also don't have to. And at the end, I'll also be sharing my contact information if anyone has more questions or if you want me to present to another group, me and my team are happy to do so. Let's jump right in. What you should know about memory loss. This is a brief overview of what we'll be talking about today. We're going to be talking about memory loss, the types of dementia, the signs and risk factors of dementia, what you can do to reduce your risk, dementia-related care, such as diagnosis and treatments, the importance of research and getting involved, and I'll also be sharing a list of national and Maryland-based resources. So we're going to start off the ground by talking about some definitions. The first term here, has everyone heard of the term mild memory loss? Okay, I see a few head nods. So mild memory loss is the gradual progressive difficulty of keeping track of new information, such as increasingly finding yourself forgetting conversations, appointments, or repeating oneself. Despite these changes, the individual is still able to compensate and manage independently. We also like to say that mild memory loss is a very normal part of aging. It happens to everyone, even folks who are still very young. And the next important term is dementia. Has everyone heard of the term dementia? Okay, I see a lot more head nods now. So dementia is the general term for loss of memory and other mental abilities, severe enough to interfere with daily life. And it is also caused by specific types of changes in the brain. So usually with the dementia, it is diagnosable, and we'll get into what criteria is needed in order to get a dementia diagnosis. But we'll jump into our next term, which is Alzheimer's disease. Has everyone heard of the term Alzheimer's? Okay, yes. See a couple more nods. So it is a specific type of dementia categorized by specific structures in the brain. So they're the amyloid plaques and tau tangles, and it is precisely those two biomarkers that make up Alzheimer's, and we'll get a little bit more into how those structures start to form. And if you take away anything, we really want to emphasize there's a key difference between normal aging versus dementia. Not everything that comes with aging is a point of concern. So we just want to emphasize that. So with normal aging, one might have difficulty multitasking and need to focus on one task at a time, but someone is still able to successfully complete that task. And with dementia, you'll have increased difficulty, concentration, and multitasking. And regardless of how hard someone tries to complete a task, they might not be able to do so. In normal aging, you'll be able to keep up with conversations, but with dementia, you'll have difficulty keeping up with conversations. And in normal aging, your judgment and insight will remain intact. However, with dementia, you'll have poor judgment and increased risk taking. And the key differentiating factor is that with normal aging, you are able to take care of yourself. However, with dementia, you will be gradually unable to take care of yourself. So a little bit more into dementia. So Carol asked a great question. What is the difference between dementia and Alzheimer's, and are they the same? So dementia is an umbrella term. An umbrella term is a word or phrase that is used to define a broader category. I think the most close example when it comes to healthcare issues is cancer. So cancer is a very, very broad term. And under that, you have like lung cancer, breast cancer, lymphoma, like things like that. So dementia is the same thing. It's an umbrella term, whereas Alzheimer's disease is a type of dementia. So is it vascular dementia, Parkinson's, frontotemporal, Lewy body, and AIDS. And I'd like to walk through the most common types of dementias. So we have Alzheimer's that accommodates for 60 to 70% of all cases, and they are categorized by those amyloid plaques and tau tangles that I mentioned earlier. There's also vascular dementia. So this is especially prevalent for folks who have cardiovascular disease or who have suffered from a stroke previously in life. There's a lot of research being done about how the blood circulation and especially the nutrients and oxygen that is being transported in the blood and the ability of nutrients and oxygen to cross the blood-brain barrier might impact dementia. There's Parkinson's disease dementia, where someone might get diagnosed with Parkinson's, and then as the disease progresses, they'll later develop dementia. There's a lot of similarity between the pathology, what is going on in the body when someone has Parkinson's and dementia. There's also frontotemporal dementia, which is also known as early onset dementia. It impacts folks in their 50s, but could be as early as their 40s. And it is a dementia specific to the front part of one's brain. There's also Lewy body dementia, which is also something that forms in the brain. And then there is AIDS induced dementia. And there's also something called mixed dementia, where there are multiple causes to why someone has dementia. And these are the most common types. A lot of research is being done to discover new causes of dementia. There's a much longer list, but for the sake of this presentation, I'm just going to share these 6. So I have a video that I'm going to play that will hopefully paint a better picture about Alzheimer's disease. One moment while I pull that up. And then I believe the audio should share, so if someone could let me know if they hear it.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination. And in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
So
What is
hopefully that paints a better picture regarding Alzheimer's disease. And I see Carol's question in the chat. Are there different stages of Alzheimer's and dementia? That is a great question, and I can address that now. There are different stages. For the most part, they are categorized as early, late, and early, middle, and late stage. Depending on the type of dementia, there are different specific stages. I believe in Alzheimer's, there are 7 stages, but for the most part, clinicians will refer to folks in much broader categories just because the time length that someone might have dementia or Alzheimer's varies. For some people, it could be around 5 years. For other people, it could be 15 years. So it's very hard to say what stage someone is in. But we want to let everyone here know that there are a lot of interventions and different treatments for early stages, but we're still ways away from a cure, and I'll get into that part in a little bit later. So dementia in the US, Alzheimer's disease impacts more than 5.7 million Americans. I believe the number is much higher because of our rapidly aging population. They are finding that more and more people are getting diagnosed with dementia. And by 2050, as many as 16 million Americans could be impacted. There was a recent study that came out in 2023 that ranked Baltimore City among the highest in the country with Alzheimer's disease prevalence. Nearly 1 in 6 Baltimore City residents over the age of 65 are living with Alzheimer's, and we'll get into a little bit about why it might be so high for Baltimore City residents. And there has been a lot of research supporting the fact that there are major racial and ethnic differences in dementia prevalence. Older African Americans are twice as likely as older white Americans to have dementia, and older Hispanic adults are 1.5 times as likely as older white adults to have dementia. We also like to throw this out there. There nationwide healthcare and long-term costs related to dementia are $259 billion, and by 2050 those expenses are expected to increase exponentially. Costs related to healthcare include, of course, medical care, but also potentially hospice, living in a nursing facility or a senior living facility, legal fees, financial fees, so all of those related costs. And they also include loss of income in that statistics because caregiving does take a lot of time, and usually folks have to either scale back how many hours they work in order to care for their loved one. So now I'm going to shift gears a little bit. There are 10 warning signs of dementia. This is, if anyone here is familiar with Alzheimer's Association, this is one of their key findings, the 10 common symptoms that you should, or the 10 common signs that you should know. The first one is memory changes that disrupt everyday life. So for example, this might be when someone is running an errand, they might forget to run that errand entirely, or while they're trying to complete that errand, forget what they are doing. And there are challenges in planning or problem solving. So someone who is very good at planning in advance or even making plans will now have trouble doing so. 3 is difficulty doing familiar tasks at home or work. So if someone has a fairly routine cleaning regimen, they might not be doing it so often, or doing things out of order or out of place. 4 is problems with words, speaking or writing. So they might have difficulty remembering specific terms. For example, they might say, oh, where are those things that I used to see with, when they mean eyeglasses. Or they might say, where is the thing that I use to clean my mouth with, when they mean toothbrush. Vision problems also become more apparent. So folks with dementia are at a much higher risk of falls and injuries, just because their eyesight and their spatial perception isn't as in tune. And a lot of people with dementia or vision problems will have to stop driving as well. And there's usually confusion with time and place. So if someone with dementia goes on a walk in their neighborhood, they might get lost fairly easily. This is actually a very common sign that people with dementia face, or if they're out somewhere that they normally frequent all the time, they'll all of a sudden not remember where they are or why they are at that particular location. Loss of judgment. So this manifests differently in people, but usually there is increased risk taking, or if someone is normally a adventurous person, they might become more of a homebody. So you might also see a very different personality. 8 is misplacing things and inabilities to retrace your steps. So I think a common thing that someone might think about a person with dementia is they might be losing their keys all the time and finding them in very obscure places like kitchen cabinets or underneath the sofa or even in their bedroom or bathroom, things like that. Normal places that someone would not have put their keys. You might see them withdraw from work or social activities. There is a slight connection between depression and dementia. They are separate diseases, but as someone is realizing that they have difficulty socializing, they might feel the need to just stay at home more often. And 10 is changes in mood or behavior. So if you've known someone for a very long time and you are realizing they're doing a lot of things that are uncharacteristic of them, that might be a sign that there might be cognitive changes or memory loss that might be taking place. And it is advised that if you or someone you know exhibits 3 or more of these warning signs, that you speak to a medical professional. And now I'm going to get into the medical problems and risks for dementia. So the major risk factors for dementia are having high blood pressure, high cholesterol, and diabetes. We don't mean to alarm anyone. Majority of older adults do have one of these 3 conditions. And we always like to say that if these things are controlled by diet, exercise, and treatment, the chances of dementia decreases as well as with the symptoms of the 3 risk factors as well. And because of these risk factors is why we see racial and ethnic differences among certain populations. In Baltimore specifically, it is a heavily Black or African American population. And amongst Baltimore Black residents, we do see higher rates of high blood pressure, high cholesterol, and diabetes, especially type 2 diabetes. So all those things in conjunction lead to higher incidence or diagnoses of Alzheimer's. It's fairly common with other cities that are very similar in population of them being higher ranked or having more Alzheimer's prevalence than other cities. So the good thing is there are ways to reduce your risk. The first is to stay mentally active. Your brain is a muscle, so having stimulating activities, whether that's games, puzzles, learning new skills, they're all different ways to keep your brain active and remain socially involved. So there's more and more research regarding the impact and the importance of social connectivity. Humans are social beings, social creatures. So it's great that you're participating in Trio Maryland and also other groups, either virtually or in person, to make sure you have a supportive network. And the third and fourth thing you'll hear again and again, everyone says it's staying physically active and adopting a nutrient-dense diet. I feel like y'all have heard a lot about those, so I won't go into it, but the guidelines for recommended physical activity, and that could be anything like walking, dancing, it doesn't have to be going to a gym, is 150 minutes per week. So you can either split that up into, let's say, like 5 30-minute walks each week, or you can do 3 Zumba classes. I'm a big fan of those dance classes. And then adopting a brain and heart healthy diet. We often say what is good for your heart is also good for your brain. So eating unprocessed foods, whole vegetables and fruits, and getting a variety of different colors in your diet is generally what's very well recommended. And the last thing is managing stress levels. It's definitely easier said than done, but finding time to do things that you enjoy, that relax you, that calm you is super important. Because if there's any caregivers in the room, the what we always like to preach is if you're sick, you won't be able to take care of your loved ones. So it is best that you look after your own health first and foremost. So reducing risk is important for us all. It's easier and more effective when it's done earlier in life because the things that I just mentioned apply to not only dementia, but also heart disease, or any cardiovascular disease. It's similar to reducing risk for cancer and just chronic diseases as a whole. And we'd like to say it's never too late to try to have a healthier lifestyle. There are small things that we can do to improve our health each day. And healthy lifestyles are important for everyone, and particularly for people who are juggling different roles in life, whether that's with work, family, caregiving, anything like that. And now we are going to shift gears a little bit, and I'm going to talk about how dementia is diagnosed. So there's no one test to see if someone has a diagnosis. Physicians use a range of different information to eventually diagnose someone with dementia. That includes a detailed medical history, information from family or friends. I think one of the biggest indications that they look for is who was someone a couple of years ago versus who they are now. If there are noticeable changes or noticeable declines, either through their medical charts or through what their friends and family are saying, that is a warning sign that someone might be struggling with some kind of memory loss or cognitive disorder. There are things like physical and neurological exams and lab tests. This might look like they're called mini mental evaluations. So it's a series of questions just to test your short-term memory. And some lab tests also now include blood tests to see specific biomarkers that folks with dementia have. And then tests of mental abilities. So there are various different types of cognitive tests. Some are shorter, some are longer, but they just give a broader indication into one of the criterias of dementia and memory loss, which is poor short-term memory. And there are also brain imaging scans that someone can get done, such as MRIs or CT scans. And this is especially important if there's a previous scan on file, just to see what are the structural brain changes from year to year. And we also always like to advocate that folks get an early diagnosis. One of the advantages being that doctors can rule out any conditions that might cause memory loss and are treatable. So the three common ones are thyroid disease, UTIs, and depression. All of these are drastically very different from dementia. However, for these diseases, memory loss is a symptom, but it's just not related to dementia. So someone who has thyroid disease can get on proper medication, and not only will they see the symptoms of thyroid disease decrease, they'll also see that their memory improves. And we also like to say that when treatments start earlier, they can be more effective, and patients have more time to plan for the future. So in case someone does have a diagnosis, they are able to participate in financial and legal decision making in those early stages. It becomes a legal challenge just because someone might not have capacity to make those kinds of decisions during the later stages of dementia. Yeah, so Priscilla asked, how can UTIs cause dementia? So that's a good question. So UTIs do not cause dementia. However, UTIs can cause hormonal changes in your body, and one of those hormonal changes might cause memory loss, but that memory loss is not related to dementia. So, in short, UTIs do not cause dementia. However, UTIs can cause memory loss, but that memory loss is different from dementia. Okay, so some of the questions that I have not addressed will I'll definitely address after the presentation. So I also wanted to say there are current treatments for dementia, and there are two main types of treatments that are approved by the FDA. The first type of medications have to deal with the symptoms of Alzheimer's. So that might be the memory loss, it could be sleeping problems, that's fairly common. So underlying symptoms that someone might be feeling or experiencing when they have dementia. I won't go into it, but here is a list. I'm not a clinician, so it is best to ask a doctor or a healthcare provider about these medications. And then the second type of medications are designed to target disease-related brain changes. So this is specifically looking at the biomarkers in someone's brain. So the FDA currently has approved two of them, and they are mainly looking at, specifically for Alzheimer's, targeting those amyloid plaques and tau tangles in the brain to stop them from growing in hopes of slowing down the progression of the disease. So yeah, as you can see, they're fairly recent. I did hear that there will potentially be another drug that will be approved either in 2025 or 2026. So there's a lot of research being done in this area to find better treatments. And that gets into my next slide. So many drug companies and other institutions like universities, like Johns Hopkins, are trying to find better treatments for Alzheimer's dementia because it is a terrible and common disorder. And we'd like to say we can all do our part in finding better treatments for patients. We can raise awareness about the disease, improve resources in the community, or get involved in community health boards, and also participate in research. So I'll just talk a little bit more about the importance of research and what my job is at a research center. So more research is definitely needed. At Hopkins, our goal is to improve understanding of the diseases that cause memory loss and dementia. We also want to find improved treatments for these diseases and also find ways to reduce risk for memory disorders. We also want to emphasize that anyone can be a research participant. You do not need to have issues with your memory. A lot of the research that we do and a lot of research studies across the nation are focused on what does healthy aging look like, because there are many changes that are just a normal part of aging. However, there becomes a certain point where it's no longer normal aging and it is more looking like a health condition or disease. If you are having mild memory problems, we want to see if there are things that we can do to improve your memory, whether that's through medications or certain activities, changes in lifestyle, things like that. And then, of course, if you've been diagnosed with dementia or Alzheimer's, we also have treatments that might be able to help. So I'm going to share a video on someone on our community health advisory board on why she chose to participate in research. And I believe you should.
My mother was a lady's lady. She was just a sweetheart. She helped out whenever she could. If she saw a need, she didn't wait to be asked. She was maybe about 64 when I noticed that she would ask me the same questions like a couple times a day. So when we went to the doctor, I asked the doctor to check her for Alzheimer's because my grandmother had Alzheimer's. Thankfully, she cooperated in the testing and she was diagnosed early. I learned about the different Alzheimer's trials and studies, and we actually participated in one. I just see that there are leaps and bounds of growth, but there's more needed. So more people need to participate, particularly in the African American community. That kind of is my impetus for trying to encourage people to get involved. We've come a long way. We've got a long way to go, but we can't get there if people don't participate in the studies. I just think it's going to be beneficial to society on whole, and all you have to do is live this experience one time and you will want it eradicated.
Amazing. So, yes, for anyone who is not local to the Baltimore area, feel free to visit the NIH website about clinical trials or research that is being done. If anyone is within the Baltimore, Maryland area, I would be happy to talk to you about the types of research that we have going on at Hopkins. And to provide a little bit more context into what research looks like, there are two types of research studies. The first is observational studies. So these studies are aiming to improve our understanding of healthy aging and diseases that cause memory loss. So we have a study here where you would come in once a year and do similar to like a physical annual, but you would do a mental exam each year, and we would just track your progress from year to year, see if your scores are relatively staying the same. This is because it's not standard to do mental assessments yet, but they do offer a lot of good information that we can use to learn about healthy aging and what it might look like for someone who is exhibiting early signs of mild cognitive impairment, which is actually the diagnosis someone might have when it's not quite dementia. It's MCI, mild cognitive impairment. And then versus when does MCI become dementia? And then a second type of observational study is an imaging study, and it provides information about the structure and function of the brain. Like I mentioned previously, these are done every year to kind of track changes that might be occurring in the brain. And we also like to emphasize that if you do a research study, all of it is paid for, all of the expenses are paid for by research grants. So it would be no cost to participate in a research study, and we also would not be contacting your health insurance. That's a very common question we get. And the second type of study we have are intervention studies. So these test whether interventions such as lifestyle changes or medications will impact someone who is experiencing memory loss or has been diagnosed with Alzheimer's. So an example of a study that we don't do anymore, but a lot of people are doing, are comparing how different types of diet modifications are impacting memory. So you might have heard that the Mediterranean study has been good to kind of treat different diseases, primarily heart disease. There are studies looking at whether a Mediterranean diet will impact someone with mild cognitive impairment or dementia or Alzheimer's. And then something that we do is whether there are different types of cognitive exercise impacting mental abilities. So this might look like we have studies that are on like video or computer games. We also have another study looking at music therapy and its impact on people with MCI or dementia. And we even have studies, someone mentioned it in the chat about hearing loss. So we're seeing someone who has been screened for hearing loss, when they start wearing hearing aids and do certain types of assessments and activities, if that will impact their memory. So that is one of the newest findings about Alzheimer's, is that hearing loss does increase the risk for someone to have dementia. And the main rationale behind that is that when we hear things, whether it's music, words, even a car driving by the street, it'll trigger different parts in our brain, and triggering the brain in that way is a form of brain stimulation. And when someone has hearing loss, all of those synapses are firing less, just because you're not hearing as much as you ought to. So then your brain is being stimulated less. And then the third type of study that we have quite a few on is testing whether medications compared to an alternative such as a placebo or sugar pill will be impacting cognitive impairment and offer treatments. I do not believe we're doing any of the treatments that are looking at targeting biomarkers in the brain. For those studies, you would most likely have to find them at a pharmaceutical company, because they're the ones who will be making the drugs. But you can also find that on the NIH's website as well. So I wanted to talk about some additional risks of research participation. So first and foremost, you'll be helping those who might be at risk, including yourself or future generations. Additionally, you would be helping to find new treatments that might benefit you or others. So one of the big things that we found from research is the connection to hearing loss, but we're also doing a lot of research on how sleep impacts memory loss, and how that might impact someone diagnosed with the disease. So there's a ton of really interesting studies about different types of treatments, where a lot of research are thinking beyond just medications and thinking more about lifestyle changes, the things that we do every single day, and how that might impact the disease. You can learn more about your health from experts. All of our research teams are made up of a combination between research scientists and clinicians. We work very closely with nurses and doctors to make sure all the treatments do benefit you. And for those observational studies where we're mainly doing testing, we would also be able to give you those scans back, or if we see something out of the ordinary, a doctor or nurse will be calling you to discuss your results to make sure that you know. And if you're a patient at Hopkins or anywhere, they'll be happy to send that information so that it's a part of your electronic health record. And for those in the observational studies, you'll receive regular monitoring by health professionals, because you're going to be doing so many assessments on your mental and physical abilities. And then you can get information about resources and events going on in the community as well. So I'd like to end my presentation by just giving a special shout out to caregivers. So just to define the term, caregivers, also known as caretakers, is simply someone who takes care of or gives care to someone else. Not everyone likes to call themselves a caregiver for various reasons, but we like to say that if you are taking care of someone, even if they're not sick, you are a caregiver, and their responsibilities might include adjusting to changes in thinking, behavior, and mood, and the ability of their loved one to function independently, seek help when necessary. It definitely includes planning for the future. So if your loved one is diagnosed with Alzheimer's, it's advised to start legal and financial planning as early as possible when they're still able to make decisions, and also to think about what late stage care might look like or what their wishes are. Caregivers are often known to be managing multiple roles. They might have jobs, hobbies. They might also be taking care of children. And then it is also very important for caregivers to take care of themselves by staying physically healthy, finding time to do things that relax you, and also managing stress levels, which is, yes, definitely easier said than done. I'd like to wrap up by giving a few tips and resources. So, learning more about memory loss, dementia, and caregiving, like you are all doing today, expanding your care team. It takes a village, not just for dementia, but anything. It takes a village. The more help you can have, the better. And remember that you're not alone. There are plenty of support groups, like this one, but also others that are virtually held or locally held. If you want something specific for Alzheimer's, the Alzheimer's Association does a really fantastic job of compiling all the support groups related to memory loss in the area. You can find your local chapter at alz.org. And if anyone is in Maryland, you can always call the Maryland Access Point for additional resources. And then here are some more resources. The first one I talked about, Alzheimer's Association, but if you would like a medical evaluation, you can come to Hopkins. We have a memory and Alzheimer's treatment center, or you can call your insurance, whoever you're covered by, and ask them if they know any neurologists or geriatricians who might be able to do that screening. A good person to ask would be your primary care physician. If you are looking for research opportunities, you can contact me, or you can go to trialmatch.org. That is also a very good resource for listing what kind of resources are or research is in your area. If anyone wants to participate in the Memory and Aging Community Advisory Board, which is the Hopkins Alzheimer's Disease Research Center's Advisory Board, you can contact me or my colleague Jasia. And if anyone is on Facebook or X, feel free to follow us. I think we post a lot of really great content. We always talk about updates, new research findings, events that are going on in the area, and also community resources. So in summary, dementia is one of the leading causes of death among older adults. Early detection has many benefits, even though current treatments are limited, and many risk factors that increase the risk of memory loss and dementia can be reduced. And taking good care of yourself and seeking help if needed means you can take better care of your loved one. So that was my presentation. I'm going to be leaving my contact information in the chat. So if anyone wants to reach out to me about anything, you're more than welcome to do so. And I'll also post the handout that I mentioned at the beginning with the summary of what we talked about today. And I believe Michelle and Marty can share that with you all via email, if that would be easier.
Yes, I definitely can. This was excellent, Claire. There's a lot of questions in here. We can go through them, but that was an excellent presentation. And I think a lot of us are wondering what stage of dementia we're in at this point. But do you want to go through them, or do you want me to go through them and read them out to you?
We can, I know I addressed some of
Right. The hearing
them.
loss you answered. I'm back. Carol Green at 11:18. When does the stages of dementia move to Alzheimer's?
Yeah, so that I can tie in also with Charles's question. So dementia is a broader term. So if someone has Alzheimer's, they have dementia. So think of it with the cancer analogy. If someone has lung cancer, that means they also have cancer. Like if someone has leukemia, which is blood cancer, they have cancer. So when someone gets diagnosed with either or, they have dementia. Alzheimer's is very specific, meaning that you have to have either a lumbar puncture, so that's when they tap into your spinal fluid, or a blood test. Blood tests are becoming more advanced. It's not a major diagnostic tool, but in research it is, to see if someone has those amyloid plaques and tau tangles. That is the defining measure of Alzheimer's. So, Carol, let me know if I answered that question. And then the next question is from Jessica. So, are there circumstances that give an appearance of dementia or of an increased severity of dementia, specifically hearing loss or UTIs which are not treated, or persons who are more heavily exposed to certain types of media which have high demands of processing forms of information? In all cases, the person may present as more confused and emotional. So I think the biggest thing that I can advise in my role is to speak to a clinician. A lot of times it can be confusing, and reading about it gives you more information, but sometimes that information can be confusing as well. There are very specific tests that someone can go through with their doctors to see, is it a UTI? Is it dementia? Is it something else? Is it just stress or lack of sleep? And by consulting with a clinician, you or your loved one will have a better idea of what are the treatment plans or next steps. I think a lot of times, and why we're looking at sleep so much, is if you're not sleeping well, your cognitive ability is kind of the first thing to go. So some people might think that they are experiencing memory loss when in reality they're just going through a period of high stress and haven't been sleeping or eating well, and that's contributing to memory loss, not that they have dementia. So I hope I answered that question. If it's not clear, I'm happy to explain it differently. Daryl asked, is there a link between dementia and having a kidney transplant? I do not believe currently they have found anything conclusive linking the two. I think if there is anything that goes that the kidney transplant isn't going well, a lot more people are looking at like high rates of infection, and also there might be hormonal imbalances that come with that, but it's not specific to dementia. But there might be someone somewhere doing research on that. It's not as common, but it's interesting to think about. Kelly said, my mom thought my dad was forgetting things she told him, and it turned out he never heard them in the first place. When we got him a hearing device that worked better, poof, his memory was fine. So that's really interesting as well. Thank you for sharing that. And then I believe I answered Priscilla's question. Judy said, I had an aunt that was diagnosed with stage 2 dementia. However, she took a fall, and within 4 weeks, she could not eat or breathe on her own, and she passed. The reason was fall-induced Alzheimer's. Is there a diagnosis like this, and why does this occur? So thank you for sharing, Judy. I'm really, really sorry that happened. It's very disheartening when things like this occur. We don't know exactly or we're trying to understand it better, but because of the spatial awareness and sometimes vision problems that people with dementia have, they're more prone to falls and injuries. And because it's hard for folks with dementia to function independently, it's also very hard for them to recover from a serious fall. There's a lot of, for example, PT training that is involved. Someone has a serious fall, they have to take various medications. They have to make sure that they're eating and resting properly. And sometimes, in not all cases, it really relies on a almost full-time or skilled caregiver to be able to provide that care. But it's not always guaranteed that someone is able to recover. For example, if they fall and broke their hip, they might not be able to walk again. And because physical activity and just different types of stimulation are involved with recovery and treatments, it's very difficult for rehabilitation to occur. And that's why we really want to emphasize prevention and also building your care team, just in case, not only with someone who has dementia, but for everyone. If you have a serious fall, it does take a lot of different pieces to get your health back into pre-fall. I'm not a medical expert. I would definitely consult a medical expert, but it is unfortunately not uncommon that something like this might happen. And then I know that's not the best to hear, which is why we're trying to spread awareness and education. And I can also provide links to other websites that talk about how to essentially like safe proof your home. You can read a lot of tips online, but there are also people who do this for a living. So they would go into your home and assess how can you make it more safe to reduce the risk of injury in someone's home. And then Walter said, I think low-fat foods needs to be defined better and maybe misleading. For example, olive oil, coconut oil, avocado oil. Avocados are good, healthy fats that feed the brain. I would recommend the books by Dr. Dale Bredesen. I'm not familiar with that that doctor's work, but there's a lot of very good things on nutrition. It's also there's a lot of misleading information about nutrition. I think if anyone wanted to speak to a clinical nutritionist or dietitians, nowadays most health insurances do cover for that service, so that could be beneficial. And then can low oxygen levels, like those from pulmonary fibrosis, cause dementia over a period of time. It is one of the risk factors. Any kind of cardiovascular disease does increase, especially the risk of getting vascular dementia, just because the brain, like most importantly, the blood delivers oxygen and nutrients to the brain. So if there's like a blood circulation issue, over time it will have negative consequences on the brain. And then Jim said about a year ago, I participated in a Hopkins study looking at transplant patients and memory loss. Are you familiar with the study? And if so, can you share results? I can definitely look into it. We have a lot of studies that are looking at various different things, but we mainly focus on studies geared for older adults. And can you join a study if you are already participating in a Hopkins clinical trial? It would depend on the clinical trial, but there are plenty of studies that do allow folks to also participate in other studies. And then for the transplant community, is there a connection between being a transplant recipient and dementia? For example, is there an effect of immunosuppression and dementia? I don't know off the top of my head regarding this in particular, just because we don't do it at our research center, but I can definitely look around to see if there's any more details regarding that. And then,
Yeah, Claire, I think we're going to be wrapping up the questions. You
Okay.
graciously provided your email address. Does that mean it's okay for people to email you if they have a
Yeah.
question that's specific to them?
Yeah, of course. Yeah, I know I didn't get into everyone's questions or comments. But yeah, you can email me at any time, and we're always happy to come back. If you follow our Facebook page, you might see news alerts from when we're doing more discussions, and you can join those as well.
That's great. And again, I'm sorry we haven't answered all the questions, but we do try to keep this presentation to an hour. It is Saturday. We appreciate your time. Thank you so much, Claire. Again, Claire graciously provided her email. You can send her a direct message and she can get back to you sometime at her convenience. And we hope everyone has a super weekend. Marty's going to close out.
Yeah, we want to thank everyone for attending. Of course, we love seeing your smiling faces from all over the country. It's good to see everyone. Don't forget to check out our events page on our website for advance notice of our future meetings. And once again, our website is www.triomaryland.org. All of our past meetings are posted on our YouTube channel for your convenience. And last but not least, have a great weekend and stay warm out there.
Don't forget the Super Bowl. Hope your team wins.
Go Eagles!
Go Eagles.
Yeah, not the truth. Thanks, Claire.
Thanks,
Again,
Claire.
thank you so much.
Thank you.
Have a great weekend, everyone.
Hey, Charles.
All right, hello. All right.
Good
Enjoy
to
the
see you,
weekend.
guys.
everybody.
Take care. Stay
Be,
safe.
be safe out there in the weather, whatever we're getting.
Yes, yes.
Thanks, Claire, Michelle, Marty.